Okay, so in the last session, we have completed about paracetamol poisoning, sign and symptoms, and intentional and suicidal poisoning of paracetamol. And when we are going to administer the NAC, N-acetylcysteine, that is a very important antidote, and the time is very important. Then we have seen that the NAC infusion is given in 3 stages: stage 1, 2, and 3. Stage 1, uh, initial dose, that is the first infusion 150, second 50, and the third 100 mg per kg. And because there is always a chance of calculation error, we have also discussed how to use the NAC IV infusion dosage guide. So this guide will help us to avoid the calculation error which can happen. And also we have discussed how to use this table. So no need to memorize the table, but you must know how to utilize this table. Then we have also seen the dosing pattern in the children based on the body weight. So the NAC infusion is given in 4 stages here rather than 3, because in the children it's given in 4 stages. Yeah, then the most important part of this paracetamol overdose is the treatment nomogram. So we have even again discussed this in detail. The nomogram, actually the nomogram original line was here above, which is this line, the dotted, but this line was reduced. They brought down this line to a 25% down. Why? Because there can be some error in the estimating time of ingestion. You need to be on safer side, and decreasing this nomogram line also increases the safety for all the patients, especially those who are at a risk. So the line is now, actually the line is this one, the red color, what you are seeing. So this is a treatment line of paracetamol for a normal patient. For, yes, this is for a normal patient. And we also have one more line you can see in this graph clearly. This for the normal treatment line for normal patient, and the line which is down is a treatment line for patients who are at a high risk. So when we give the NAC, can you tell me by using this, if the paracetamol level in the serum, if it is above this nomogram line or below? When should we administer the NAC? Whether
If it is above
if the paracetamol level is above the
the line.
nomogram line, yes, that indicates we have to give the N-acetylcysteine infusion. Good. And also we have seen some scenarios at the end. uh, you know let me show you. Yes, we have seen these cases. So you will try to find out whether the patient or the person is uh, high risk or no high risk, etc. This flow chart also we have discussed. Okay, so we have to start from here. So let me just brief this flow chart. Already we have discussed this. So the basic thing which you must know is this: the acute ingestion of paracetamol flow chart works on the time, from the time of ingestion of poison, whether the patient comes within 1 hour or the patient comes from 1 to 8 hours, or whether the victim is brought after 8 hours. So based on that, our treatment management differs. This is explained in detail. Okay, what are the other supplementary investigations? So for a patients that present within 8 hours with a known time of ingestion, risk assessment is based on the serum paracetamol level plotted on the nomogram. Yes, and if the patient comes to the emergency room within 8 hours, and you also know the time of ingestion, means If the patient's relatives say, oh, he ingests the paracetamol before 4 hours, before 5 hours, so you know the time, and the patient is presented within 8 hours, then you will check the serum paracetamol level and you will draw a graph on the nomogram. Okay, this is there. Then what supplementary investigation means? Apart from checking the serum paracetamol level, what other test we can carry out? Supplementary investigations such as liver function test. Yeah, this will be the supplementary. Other than checking serum paracetamol level, you have to do that. Apart from serum paracetamol level, we can also do the liver function, ALT and AST. These are supplementary. A coagulation profile. Do not refine the risk assessment and do not provide useful baseline data, uh, or change the management in this group. Okay, so the supplementary investigations like liver function test or coagulation time, just I am repeating, the coagulation profile time and the liver function test does not help in a patient who has come to the emergency room within 8 hours and you know the time of ingestion. In this case, these supplementary tests are not useful. However, these tests are therefore not indicated unless risk assessment for another agent requires them. Yeah. Yani if within 8 hours, no usefulness of these two tests. Okay. What about the patient who comes after 8 hours? In a patient who present 8 or more hours after ingestion, N style should be commenced immediately. And it should be started immediately. If the reported dose exceeds the threshold of possible toxicity, means, you know, 200 mg per kg or 10 gram within 24 hours, like this, the paracetamol threshold table we have seen. You remember this table? Two type of ingestions. One is acute single ingestion, and second one was repeated supratherapeutic ingestion, and one was for adult and children more than 6 years, and another one was for children who are less than 6 years. So if the paracetamol ingested is more than that threshold level, and if the patient is coming more than 8 hours, or if the patient shows the clinical signs suggesting of paracetamol toxicity, like, if the patient is having nausea, vomiting, right abdominal pain, and tenderness, so what we will do, we will of course evaluate the serum paracetamol level, and also liver function test, that is ALT, should be performed as soon as possible. Is that clear? Is that clear, ya Shabab? Are you following me?
I'm following you, doctor. Yes.
Yes,
Oh,
doctor, yes.
so as simple as it is, if the patient comes within 8 hours, just check the serum paracetamol level and plot on the graph. No need to check liver function test and coagulation test. If it's more than 8 hours and the patient has really ingested a toxic amount, then check the serum paracetamol, start the NAC alathul, and also check the liver function test. Okay, so here I will show you. This is a diagram, very easy and important. Yani what test you will perform in a patient or a person who has ingested paracetamol overdose. Okay, so you will do serum paracetamol, or you will do ALTST, or you will do coagulation time, creatinine, urea, glucose, or ABG. What you will do, it depends on, remember simple thing, it depends on the time from the ingestion of paracetamol. Is that clear? So if it is between 1 to 8 hours from the paracetamol ingestion, any early presentation. If it's 1 to 8 hour, then remember, no need to do any test, but only one, that is serum paracetamol. That too you will check at 4 hours. So check the serum paracetamol at 4 hours or as soon as possible thereafter. Yani, just tell me a logical question. If there is a someone, he ingests a paracetamol overdose and he comes to the hospital after 2 hours, will you check his blood paracetamol level at 2 hours? My question is,
I'll check
one
his serum. Yeah.
one of the patient or a person, he ingests paracetamol overdose and it is toxic also, and he comes to the emergency room after 2 hours of ingestion, will you take his paracetamol level at that 2 hours? No,
No.
you
If
will
he
No,
not.
doctor. No. It must be 4 hours at least.
Yes, because the nomogram applies only after 4 hours. The nomogram is
Yeah.
applicable, and if you check before 4 hour, like 3 hours, that value is not useful for me. So that's what they are saying here. If a patient comes between 1 to 8 hours, check the paracetamol level at 4 hours or any time after 4 hours, any 4:30, 5 hours, no problem. Good. Next, no need to do any other test. Yes, someone raise the hand, please. iPad. The name is not there. It's just showing iPad. Okay. No need to do other test. And if the patient is coming between 8 to 24 hours, of course, you have to do the serum paracetamol level on admission. Any ala tool. Start the neck and take the serum, check the paracetamol on admission. And ALTST on admission. Yani, once the patient is admitted, take the test. That is 8 to 24 hour. And also you have to do the liver function test on admission, yani once the patient is admitted, and also at the end of N-acetyl cysteine infusion. Means once the N-acetyl cysteine infusion finishes, how many hours it will take for N-acetyl cysteine to finish? How many hours you will give the infusion? How many hours N-acetyl cysteine infusion? 20 hours. Am I right? First infusion around 15 minutes or 60 minutes. Second stage 4 hours. Third stage 16 hours. Okay. No need to do any other test. And if the patient present more than 24 hour, all yes, on admission, on admission, on admission. It means as soon as the patient admit in the hospital, do all the tests. Do the glucose, do ABG, do urea, creatinine, clotting time, then paracetamol, all. Or you can, some student can remember it like this: 1 to 8 hours. Any no, I'm sorry. I can give you another trick how to memorize. Serum paracetamol, yes, on all the hours. ALT 8 to 24 and more than 24. All other tests only 24. Is that clear?
Yes, doctor.
Yeah, like this also you can memorize. So now the next scenario is what to do when the nomogram does not apply. There are some situations where nomogram, you cannot use nomogram. I mean, there are some situations with the patient, yani nomogram is not helpful to you. What is how this situation will come? Yes, how the situation will come? The situation will come when there is unknown time of paracetamol ingestion.
Time ingestion.
Yani, like suppose, just example, suppose a patient comes to the emergency room in the hospital and he has taken overdose of paracetamol, but no one knows he took this paracetamol at what time: before 2 hours, before 5 hours, before 10 hours, before 20 hours. Yani, you don't know the time. How you will apply nomogram? Nomogram can be applied only when if you know the timing. You got my point? You must know the
Yes,
time.
because it really.
See tahat, time. If you don't know the time, where you will plot the value, here or here or here, where you will plot if you don't know the time? It's confusing. Okay, so unknown time of paracetamol ingestion, is the situation where we cannot apply the nomogram. So what to do? What to do then? Then what you can do is, in this scenario, if there is a detectable paracetamol level with unknown time of ingestion, commence NAC and treat the patient as per the end of more than 8-hour scenario, like this. Yani, just for example, suppose a patient comes to the emergency of hospital, and of course he has taken paracetamol, but we don't know the time when he or she has taken overdose. Time is not known. Okay, no problem. Take the blood. Okay, do the test for serum paracetamol. If you find a detectable amount, yani enough amount of paracetamol in the serum, then what you will do? You will start the NAC alatul. Yani no need to go to nomogram because it's not helpful. I don't know the time, but there is a paracetamol in the serum. So commence the NAC, start the NAC, and treat the patient as per the more than 8 hours. You know where? Uh, can you see this, the plus sign in this chart? Yes, can you see?
Yes.
Yeah. So if from here you will start, for which patient you will start from here? For the patient who comes to the emergency room, he has taken paracetamol overdose, but we don't know the time of ingestion. Then what I will do? I will take the serum, I will check the paracetamol. If there is a detectable amount of paracetamol in the serum, I will start the NAC, and my treatment start from here now. Yani I will finish the NAC full. I will give him NAC 3 stages. Then after that I will check the ALT. Yani I will follow from here. Hope this is clear. For the
Yeah,
patient,
clearly.
yeah, for the patient we don't know the time of ingestion, I will start from here, this plus mark. Yani his treatment plan will start from here. Nothing will apply from other place for him. Okay, next is a staggered overdose. What do you mean by staggered overdose? Staggered overdose means uh, it comprises of several ingestions over a period of less than 24 hours. Means uh, here a patient has taken overdose of paracetamol, but not one time. He has taken multiple times, but within 24 hours. Okay, let's see an example. If the patient has taken an overdose of paracetamol at 2-time interval within the last 8 hours, interpret the level as if all the paracetamol was taken at the earliest overdose and treat the patient as per the 1 to 8 hour scenario in acute ingestion of acute ingestion flowchart. If it has been more than 8 hours since the first dose, treat the patient as more than 8 hour scenario in acute ingestion management flowchart. So here what they are saying is, I will explain you this one with the example. Please follow me. Suppose one patient comes to the hospital with overdose of paracetamol, and you know that he has taken around 4 gram paracetamol. He has taken 4 gram paracetamol, suppose at 10 o'clock in the morning. Okay, 10 in the morning. And again he took 6 gram. Again he took another 6 gram of paracetamol. But first one he took at the 10 in the morning, and another he took at 12 in the afternoon, just say. And he comes to the hospital, or someone bring him to the hospital at afternoon 2 o'clock. Is that clear? The scenario?
Yeah. So 4 hours.
Yeah. So patient take the 4 gram paracetamol at 10 in the morning. Again he takes 6 gram at the afternoon 12, but he comes to the hospital at 2 o'clock. So now he took the 2 doses at 2 different time. But what you will consider? You will consider that which is the earliest for you. 12 is earliest or 10?
10.
No, for you, the for hospital time, which is garib, which is near.
12,
12,
yeah.
doctor, 12.
Yeah, 12. 12 is the nearest one, but yes, the earliest one means the before is 10. So what we consider is, we consider like all the 10 gram, the one he take 4 gram and then he take 6 gram, we consider he take all the 10 gram of paracetamol at 10 o'clock in the morning. You understood my point? If it is within 8 hours, yani of course he take at two different timing, but what you will consider, you consider that all the 10 gram was taken by him at morning 10 o'clock. You will not consider differently. Okay, and you will start treating the patient. Yani how many hours it will be? From 10 to 2, 4 hours. So you can check his paracetamol level and start the NAC if it is above the nomogram line. Is that clear or no?
Clear.
If a victim takes 2 doses within 8 hours, you will consider as if all the dose was taken at the before. This earliest means yes 10 here, earliest means the 10, and you will start the treatment according to the serum paracetamol level if it is above the line. And if there is more than 8 hours since the first dose, treat the patient as per the more than 8 hour scenario. You know this flow chart. More than 8 hour scenario, this is 1 to 8 hour scenario. Okay. What to do if a patient has taken sustained release paracetamol preparations? What to do if the patient has taken sustained release paracetamol preparations? So if more than 10 gram or 200 mg per kg, which is a threshold dose, has been ingested, start the NAC. Yani you will not check the serum paracetamol level here. You are getting my point? But you should know that the patient has taken paracetamol sustained release. You should know that the patient has taken paracetamol but sustained release preparation. And what is the dose? Dose is threshold, more than 10 gram or 200 mg per kg. If you know this, start the NAC immediately. After starting the NAC, then you will check the serum paracetamol level at 4 hours or more post ingestion. Then again 4 hours later, if the first level is below the nomogram line. If both levels are below the nomogram line, NAC may be discontinued. If either level is above the nomogram line, NAC should be continued and management should be followed according to the acute ingestion management flow chart. Is that clear here? I'll give example. Let me, I think, explain with the example. Suppose you have a patient and he has taken sustained release paracetamol tablet and the dose of paracetamol taken is high, yani threshold. Once he come to the emergency in the hospital, what you have to do? First thing you have to do is you have to start the NAC because it is sustained release. Okay, you are getting my point?
Yeah, yeah.
Because in sustained release preparation, in the pharmaceutics how it works. So if someone has taken sustained release, if I check his paracetamol, will that paracetamol in the serum give me clear picture? No, it's sustained release, means it's a slow releasing paracetamol. Maybe I check the paracetamol in the blood, it will show me very less, but it's slow release. After some time maybe the drug will be released again. You are getting my point?
Yeah, continuously releasing, doctor.
Yeah, continuously releasing. So I will not go for checking the paracetamol in the serum as in the beginning. I will just start the NAC. I will just start NAC. Maybe the patient is coming to me after 2 hours, after 3 hours, after 4 hours, whichever hour, I will not see. I will just start the NAC if it is sustained release preparation. After starting the NAC, okay, after starting the NAC, I will check the paracetamol now at 4 hours. Okay, is that clear? Then again, after checking the paracetamol level at 4 hours, I will wait for 4 hours. Then again, I will take another serum paracetamol reading, and in a gap of 4 hours. Is that clear?
It's clear, doctor.
Measure the serum paracetamol level at 4 or more hours post ingestion. Then again at 4 hours later, if the first level is below the nomogram line, and if this is the first one, if this is below the nomogram line, I will take again another one after 4 hours. Yani I have now how many serum paracetamol reading now? I have started NAC. I have already started the NAC. After starting a NAC, I will take the serum paracetamol level one reading yani at 4 hours. Then again, I will take one more reading after 4 hours. So I have two readings. So what they are saying now, if your both readings or if both the levels which I have for serum paracetamol, if they are below the nomogram, I have to just discontinue the NAC, N-acetylcysteine infusion. Yani the serum paracetamol reading at 4 hours, then again after 4 hours. So if both are below the line, discontinue the NAC. If any one of this is above the line, if any one of this is above the line, I have to continue the NAC treatment. Okay. Yeah, now this was what you say the treatment plan for acute single injection. Now, what is the treatment plan or the chart for repeated supratherapeutic injection? Here, the patient or the victim, he takes multiple doses of paracetamol at, within 2 days, within 3 days, multiple, repeated. So, what is the chart? If the patient has ingested sufficient doses to suggest risk of developing hepatic injury, this already this table is mentioned to you in the previous slides. How you can say this is a repeated supratherapeutic injection, at least 10 gram or 200 mg per kg over a 24 hours, like this. So if you know that the patient has ingested the sufficient doses to suggest the risk of hepatic injury, then we have to manage the patient as per repeated supratherapeutic injection management flow chart. This is a chart. Okay. So what is the first thing you have to do? First thing is, does the patient meet the criteria for supratherapeutic ingestion or not? How you know the patient meet the criteria or not? By using the following table. Is that clear?
Yeah.
Look, if someone take around 10 gram of paracetamol and come to the hospital after 4 hours, that will be acute. You got my point? Anything which start after 24 hours, 24 hour, 48 hours, 72 hours, that is repeated supratherapeutic. You can remember in this way. So once the patient comes under this category, first thing what you have to do, okay, suppose he has not taken a repeated supratherapeutic injection, means no management, yani he does not belong to this chart. Okay, suppose the patient has taken repeated supratherapeutic injection, then what you will do, you will take the patient in the hospital, measure the serum paracetamol level and check the ALT, check liver function, check the serum paracetamol level. Okay, so what will be your result? For example, ALT is normal. Suppose ALT is normal and the serum paracetamol level is less than 20 microgram per liter, which is very, very less. If your result is this, yani ALT is normal and serum paracetamol level is very low, 20 mg per liter, then what? No further treatment is required. And no need to give him NAC or any drug, just monitor him. And he has no liver injury. because ALT is normal, paracetamol is very low. Okay, if these results are abnormal, and also if there are any other results which shows that the liver injury is there, then you have to start NAC infusion. After you take the NAC infusion, you have to finish it in 20 hours. You give first stage, second stage, third stage of NAC infusion. Then again, you will repeat the serum paracetamol level and ALT at 8 hours. This same test you will perform. If ALT is normal, yani his liver function is improved, no need to treat. You can stop the NAC. If ALT is not normal, again continue the NAC and check the ALT at 12-hour intervals. Okay, and other parameters are measured as indicated, means glucose, clotting time, ABG, arterial blood gases, other things also you can measure. I have shown you this structure. Okay, so now yeah, the last thing about paracetamol poisoning is, yes, you can see in the image, liver transplant. Can we do a liver transplant in a patient or in a person who has ingested a very high amount of paracetamol? We will see that. Who should be immediately referred for liver transplant? Any which type of cases you transport them or shift them to the the liver transplant unit? Yes. So the King's College criteria for acetaminophen toxicity for liver transplant, yani they have given a checklist. If the patient comes in this checklist, then probably that patient needs liver transplant. Yes, what is the criteria? If the pH, arterial pH is acidic, less than 7.3. If the INR, INR is what you call for clotting.
Clotting time.
Yeah, international, something normalized ratio. It's like this.
Yeah.
INR is for for clotting. If it's more than 6.5, then again it indicates that liver transplant should be considered. If the creatinine level is 3.4 mg per deciliter, if there is grade 2 or grade 4 hepatoencephalopathy, liver injury, grade 3 or 4, hyper lactatemia, any more lactate in the blood, and if there is acidosis, okay, hepatic encephalopathy, coagulopathy, acute kidney injury. So these are the the checklist. If you find this one in a patient with who has ingested paracetamol overdose, then that candidate should be referred to the liver transplant unit, and they will do it if the things are suitable. Okay, these examples we have solved in our last session only. Yes, any question so far?